Doctor, thanks so much for joining us. Our topic in this edition of Health Connection is pelvic pain, an equal opportunity complaint, meaning men and women. Let's start off with a question. How common is pelvic pain for women and what causes it?
The figures are a little soft
Okay.
because the diagnosis is, by definition, they don't know what the cause of it is, at least for true chronic pelvic pain. But it's estimated that for women between the ages of 15 and 50, 15% may complain of pelvic pain, and it accounts, some people estimate, for 10% of the visits to a gynecologist. So it's a relatively common issue.
How do women with chronic pelvic pain describe their symptoms?
It's really a potpourri of symptoms. Oftentimes in women it's associated, or at least in their mind, it's associated with voiding. Oftentimes the need to urinate precipitates the pain. Voiding can precipitate the pain. And a classic symptom, voiding, when they're done voiding, the pain obviously improves, but that's the classic constellation. But there are a lot of different permutations. Some women complain more of rectal pain, some complain more of vaginal pain. It's not a fixed one set of symptoms fits everybody.
A woman comes in complaining of pelvic pain. What are some of the things that you look for in terms of diagnosing the underlying cause?
Well, the first is to differentiate relatively acute pain versus chronic pain, because really what you're getting into is chronic pain. And so the first thing is to differentiate things that you can clearly identify as a cause of pain, because the chronic pelvic pain syndrome, bladder pain syndrome, an older term is interstitial cystitis. By definition, when you use the word syndrome, means we don't know what causes it. It's just a constellation of symptoms. So those sorts of things are harder to treat. So you got to rule out things that you can clearly identify. Endometriosis, for example, urinary tract infection, stones. Those things are, if you can define the etiology clearly, most of the time you can treat it fairly successfully.
Well, let's move on to treatment. Once you have identified it, assuming you have a good identification, what types of treatment are available for women with pelvic pain?
Well, if you have a clear diagnosis, really it's a matter of semantics. Usually when we use the term chronic pelvic pain, we refer to women who we can't make a diagnosis. In other words, I can't say you have a kidney stone, I can't say you have endometriosis. You have pain, and I can't tell you why you have pain. And that's what the term chronic pelvic pain really means. So obviously you identify a clear cause. One, you can treat it. Two, that usually resolves it. And then three, you don't really have chronic pelvic pain. You've treated it successfully, the pain resolves. And so there is no diagnostic test, if you will, to say that you have chronic pelvic pain. As for most pain syndromes, it's rule out the things you can identify. And if you've ruled out everything you can identify and still have pain, then you start getting into the chronic pain syndrome.
And if you find yourself there, then what can you do to treat?
Then there's a variety of modalities. In women, again, a common term is interstitial cystitis, but people are finally getting away from that term. It's an old term in terms of what they used to think the pathology was. It may have very little to do with the bladder, at least in a number of patients, and they're really moving more to bladder pain syndrome or just chronic pelvic pain, which is a better term in terms of what we understand or don't understand. But since you don't have a clear diagnosis, you're left with symptomatic treatments that have been tried in the past and help some percentage of the people. Diet can help, a variety of different kind of medications, pain medicines, narcotic and non-narcotic can help. A variety of interventions. There are medications that can be instilled in the bladder. The bladder under anesthesia can be overfilled, which stretches it, which is in some patients is very beneficial in terms of improving their symptoms for a while. Most patients are not going to be cured of the problem. What you're going to try to do is make it tolerable so they can get on with their daily life.
We've been talking up to now mostly about women. Let's switch to men. How common is pelvic pain for men, and what are the possible causes?
Well, there's a parallel. The old term for women is interstitial cystitis. The old term for men was prostatitis, because it used to be felt that particularly if you were under the age of 50 and you were a male and you had any perineal or suprapubic pain or urethral pain, that must be prostatitis. And there's a classification system that's based on that, but it's now termed chronic pelvic pain syndrome, which is a better term. Strictly speaking, you try to identify whether or not there is actual infection of the prostate. If there is, antibiotics can sometimes resolve that, or at least diminish it. If you have a chronic infection, you can't always resolve that. If there's no infection resolved, then a lot of the interventions are similar to what you'd use for the women in terms of pain medicines, narcotic, non-narcotic, with the exception of a class of drugs called alpha blockers, which sometimes can help the men. Those typically aren't used too much in the women.
Man comes to you complaining of pelvic pain. What questions are you going to be asking of that patient?
Well, as a urologist, I want to try to associate. There's lots of things, lots of organs live in the pelvis. So as a urologist, we deal in a male with the bladder and the prostate and the urethra, but colon lives there, blood vessels live there, soft tissue lives there. A variety of pathologies can cause pain. So the first thing I want to do is try to decide, do I think this is a urinary cause or genitourinary cause of the pain, or are there other indications for rectal pain? They may need to see other specialists. But again, same as for the women. If you can make a clear diagnosis, you can intervene, usually, definitively, and by definition they don't have chronic pain or the chronic pain syndrome because you've identified a clear cause, and usually you can treat that. And so what you're left with, again, as for the women, you go through your rule out list, and if you ruled everything out and you can't find a clear diagnosis and they still have pain, then they end up with a diagnosis of chronic pain syndrome.
Well, if we've identified it and if we've figured out what we're dealing with, are the treatments for pelvic pain in men different than they are for women?
Only to the extent that men and women have different organs. For example, if you have gynecologic organs, the uterus or the ovaries are the cause for the pain, obviously men aren't going to have that. If the prostate is the source of the pain, then women aren't going to have that. But for bowel issues, appendicitis, stones, those are not sex dependent, so to speak. Either sex can have it. If you end up with no clear diagnosis, again, except maybe for one type of medicine called alpha blockers that sometimes helps pain attributable to the prostate, a lot of the pain modalities are going to be the same regardless of the sex.
You may have just answered this question with that last question. What are some of the pelvic pain conditions that are common to both men and women?
Well, again, if you're looking at definable causes, for women, you've got gynecologic causes of pain, such as endometriosis, painful menstruation, ectopic pregnancy. All that's going to be more of an acute pain than a chronic pain. Ovarian tumors or cysts can cause pain. Men aren't going to have that. Inflammatory disease, chronic infections of the uterus or the tubes from the ovaries or the ovaries themselves. And then for men, you're going to have prostate and maybe a more urethral pathology. But there's a lot of things that are quite common. Again, your bowel, your appendicitis, your diverticulitis, Crohn's disease. Those are not sex dependent. Those are going to be the same potential causes regardless of sex.
What are the consequences of failing to identify the cause of pelvic pain or not treating pelvic pain for men and women?
Well, if there's an identifiable cause, you miss the diagnosis, obviously you're not treating the patient's pathology. But assuming that definable pathology has been ruled out, not treating the pain, as with any chronic pain, can have create significant morbidity for the patient. Depression, economic losses. You can't work if you're having a lot of pain. You can't deal with your family appropriately. It's going to affect every aspect of your life. Most all of us have had acute pain, not chronic pain. And so we can all relate to when we're really having an acute pain, we don't tend to do much of anything. Well, now convert that to a chronic basis. What would your life be like? And it's usually pretty evident, a lot of the ramifications that come from that problem. And a lot of the, even though we don't have a diagnosis, a lot of the times, for example, chronic pain physicians are very useful in this regard because you can create problems with treatment. If you prescribe narcotic inappropriately, you can end up with a drug addiction. Now you've added another layer to the patient's already significant problem. it can be avoided if it's managed appropriately.
Very well. Doctor, I learned a lot. Thank you very much.
Thank you.